The coronavirus has placed us in a situation that we never have encountered before, a pandemic and a new virus that affects the whole world. In November, December, the National Institute of Public Health invited 58,000 Norwegians from Oslo, Agder, Nordland, and Vestland to a comprehensive survey about action against infections, quality of life, and mental health. The results show, among other things, that more people struggle with loneliness and mental illness, and 1 in 4 is not happy with life. One of the biggest challenges with COVID-19 is that everyone is affected differently. This means that the patient in many ways become the expert in their own course of disease. It is crucial to collect the individual experiences for both research purposes and to help facilitate for patients to share between each other. You can read and hear about infection rates and symptoms everywhere in the media, creating fear, focus, and treatments for short-term effects of the disease. On the other hand, we only have 1 year of data and research to look back on, and new information is constantly coming. Some experience the course of disease as short-term, but there is also many people who struggle with long-term challenges. These varies from fatigue, cognitive challenges, and other symptoms. We don't know how the long-term effects will evolve, which is what we now need to prepare us for. We are Åsmund, Anna, and I'm Kamilla. We are the COVID rehabilitation group, and we will now present our final proposal. Our presentation consists of these 4 parts: our insights, our service, a scenario, and our reflections in the end. This is our insights. To begin with, this has been a research question during these weeks. How can hospitals, municipalities facilitate for COVID-19 rehabilitation patients to support each other?
In the project, we got the opportunity to talk to 2 nurses, 1 department manager, and 1 couple who have had COVID. And this led us to our 4 key findings. The first key finding is the public knows little to nothing about the after effects. A COVID long holder said, "It was difficult to find information about the after effects, and we have not been shown where to find the information. As we said in the introduction, media publishes little information about the after effects, which makes the public less aware to what the after effects may be. Finding information is left to the individual, and there is insecurity around where to find it." The second key finding is that the GPs work as a bottleneck. Like this COVID long holder stated, "At times I felt I had to work to be believed by my GP. That's not how it should be. All I wanted was to be heard and understood." And the nurse said that the patient feel like they have to push and convince the GP to be heard. There are 2 main aspects with this finding. The first one, patients do not contact their GPs in time. This because the infected person often is having a hard time judging if the symptoms they feel are related to COVID or not. This can be connected to the first key finding about lack of information. The second aspect is that some patients feel not believed by their GPs and feel they have to push and convince to be heard. The third key finding is opportunity for sharing between patients. A patient said, "When you don't hear about anyone else who experiences the same way as you feel a little left alone." In the end of the interview, one of them rushed to stop us before we left. "But before we leave, have you talked to anybody else? Because we are really interested to hear what they have experienced and what challenges they face." We have seen that there are several Facebook groups dedicated to discuss COVID after effects. So there's absolutely a need to share experiences. But these groups are open for everyone and are not regulated by healthcare workers. Our last key finding is little to no focus on mental health during rehabilitation. A patient told us that they mainly focus on the physical, not so much on the mental. And one of the healthcare workers said, "Without focus on mental health, it's like trying to get well with the brakes on." We have heard that some actors are working with mental health, but there is still an overall lack of focus on it today. I will now introduce you to our concept, My COVID. My COVID is a new service offering. It is a service that maps COVID patients' mental, physical, and cognitive health through the course of the C, collects and convey data on the patient premises, and gives the opportunity to connect with other patients with similar situations. My COVID encouraged all patients to share their data to help the healthcare sector for further research because of the big variety of symptoms that COVID-19 has. This gives also the healthcare workers the opportunity to follow the patient development of the condition based on the patient's daily tracking. My COVID is owned by the municipality and the patient. This because of the strict restrictions where hospitals and rehabilitation is not allowed to connect patients, but they can get access to the data by request. My COVID collects and share data, follow up based on your health condition, and share between patients.
To illustrate the service, we have created a scenario which I will now take you through. So this is Emma. Emma just took a COVID test and are now waiting in quarantine for the test results. She gets a call from the contact person from the municipality. He informs her about the positive test results and strongly encourages her to start tracking via MyCovid. Emma downloads the MyCovid app and registers with her social security number before she gets a MyCovid ID to maintain anonymity. Emma started 10 days of isolation. She starts tracking her mental, physical, and cognitive measurements in MyCovid. On Wednesday, while Emma is doing laundry, she notices shortness of breath and feeling a bit tired, but do not think any more about it. On Thursday, Emma starts to feel some pain in the chest area, in addition to heavy breathing, which is something she has not felt before. On Friday morning, she wakes up feeling very bad and does hardly manage to get out of bed. She registers this in the tracking section of MyCovid. While Emma continues to track negative numbers, the doctors from the municipality have a live view over the users of MyCovid are doing. They can see that Emma's condition is approaching red level. Eric, the doctor from the municipality, calls up Emma. He considers her condition to be hospitalized and she sends her an ambulance right away. So Emma is sent to the hospital. On arriving at the hospital, Emma receives a notification that the hospital wants access to her data and tracking. The nurses at the hospital can now view Emma's development via MyCovid. Emma is in a respirator with oxygen supply on isolation and her condition is poor. The healthcare workers help her to track her condition and development if needed. After 9 days in isolation, Emma is finally starting to get better. During her stay, Emma gets offered a place in rehabilitation at Sunnaas due to the fact that her breathing is still bad. Emma arrives at Sunnaas Hospital for rehabilitation. On arrival at Sunnaas, Emma gets a notification that tells her that Sunnaas wants access to her data, and she continues to track data through her stay. The healthcare workers at Sunnaas can see that Emma's mental health is on red level. They think that this may be due to isolation over time. They implement measures to improve her mental health. The hospital facilitates for more frequent talks with next of kin and friends. More social contact makes Emma's progression go in a positive direction. After 40 days in rehabilitation, Emma is finally back home. And now she continues to track her condition once a week, just in case something happens in the future. After 5 months, Emma becomes worried when she discovers changes in her blood vessels. She is wondering if someone else have experienced something similar and goes to the discussion page in MyCovid to post about the observation with her blood vessels. She receives answers from several others who have experienced something similar. This makes Emma not feel so alone. 2 months after, Emma experiences a fallback with shortness of breath. The doctor from the municipality can see this through the overview and call her for a follow-up if necessary. Emma is still having some challenges with her blood vessels, but she is more calm now when she have talked to others with similar experiences, and she also knows that she will be taken care of if needed.
So what's in it for me for the different actors? For the patient, it's a follow-up adapted to your development. opportunity to get in touch with others, to share experiences, and something that can support your explanation to your GP so that you don't have to convince them to be heard. For the municipality, get an overview over patients in the area, continuous updates on patients' health condition to follow up, collect data for statistics, collect more data about the after effects, and tell the knowledge to the population. For the hospitals, quickly get to know the patient's history and being able to take action with confidence during the course of disease. And for the GPs, he or she can quickly get to know the patient and the history of their experience during the course of disease, and a stronger relation between the GP and the patient so they believe in each other, and a tool for conversation.
And then some reflections. The design is not done, and we have some ongoing design discussions like, should the patient know that the graph is showing green, yellow, or red, or will this allow the patient to influence the information they provides? How big is the danger for an echo chamber to arise? How can we, in the best possible way, collect research and distribute tips coming from the patients? And should the patient be able to see other patient graphs to have transparency and to learn? Or would that make them compare themselves to others in a negative way and make them more stressed? We hope that MyCovid is something that could help all these actors in this ongoing situation and the time ahead. Thank you.